Thank you all for joining today. Let's start by discussing a significant issue affecting workplaces worldwide: substance abuse. It's one of the most pressing public health challenges we face. Every employee has the legal right to a safe working environment, free from the risks posed by colleagues using drugs or alcohol. When impairment occurs, it isn't just the user at risk. Innocent bystanders, their coworkers, may also suffer from increased injury rates. For employers, the consequences are equally severe. Productivity takes a hit, turnover rates climb, and insurance premiums rise. Not to mention, the overall employee morale suffers, which affects company culture and success. Our focus today is on creating a safer and healthier work environment. The purpose of our program is simple yet powerful. It's to deter the use of drugs and alcohol at work. By following the steps in this plan, we aim to significantly reduce the risk of injuries to our coworkers and prevent damage to property that could occur from substance use in the workplace. These rules are not just guidelines. They are a commitment to safety and responsibility, and applicable to all employees working for Crain Construction. It's important to understand that this isn't just about compliance, it's about ensuring everyone goes home safely at the end of the day. As we proceed, we'll delve deeper into how this policy addresses various questions and scenarios you might encounter. Let's work together to uphold these standards. Now, let's begin by discussing the core items of our drug prevention policy. First, the policy clearly outlines its purpose and the scope of who is covered. This ensures everyone knows their responsibilities. It's important to highlight when the policy applies and what specific behaviors are prohibited. This clarity helps in maintaining a safe and productive work environment. Additionally, the policy requires employees to notify supervisors of any drug-related convictions. Transparency is key in fostering trust and compliance. The policy also addresses whether searches and drug testing are included. Understanding the procedures and which specific drugs are tested for is vital for both compliance and accountability. We will discuss the consequences for violating this policy. It's crucial for everyone to understand the implications of non-compliance, as it underscores the seriousness of maintaining a safe workplace. Next, we'll touch on return-to-work agreements. These agreements provide a pathway for employees who have violated the policy to return to work under certain conditions. This demonstrates our commitment to support rather than punish. We'll also highlight the assistance available to employees. Providing resources and support is vital for those who may need help, not just for compliance, but for their well-being. Confidentiality is another cornerstone of our policy. Employees can trust that their privacy is respected, encouraging them to seek help without fear of stigma. Next, we will discuss the responsibility for enforcing the policy. It involves everyone from supervisors to HR, ensuring consistent application and support across the board. Finally, we'll cover how the policy is communicated to employees. Clear communication ensures everyone understands the policy and knows where to find support. These elements together create a comprehensive framework for a safer, more supportive workplace. Today, we'll focus on the objectives of our policy. Firstly, the policy includes clear definitions to ensure everyone understands the terminology used. This is crucial for clarity in communication. Next, we'll discuss some critical facts about alcohol and drug abuse. These facts highlight the seriousness of the issue and why it's essential to address it effectively in the workplace. We'll then explore the impact that alcohol and drugs can have on the workplace. It's important to recognize how these substances might affect performance, safety, and overall team dynamics. Understanding the link between poor performance and substance abuse is crucial. We aim to equip you with the tools to recognize potential issues early on. This awareness can lead to timely interventions and support. We'll also delve into the progression of addiction, which often starts subtly but can escalate if not addressed. Being informed helps us support our colleagues better. Lastly, we'll discuss the types of assistance available. Our goal is to ensure employees have access to the support they need, reflecting our commitment to a healthy and supportive work environment. Let's take a moment to discuss some essential definitions related to addiction and substance use. First, addiction is recognized as a disease. It involves complex interactions between biological and environmental factors. It's important to understand this complexity, as it influences how we approach treatment and support. Now, a disorder is more than just confusion. It can significantly impair personal functioning. This highlights the importance of early intervention and support. When we talk about use, we're referring to low frequency or irregular consumption of alcohol and drugs. However, abuse represents a shift to regular or compulsive urges to use, which requires our attention and action. Finally, relapse, a term often surrounded by stigma, is simply a setback in someone's health after they've shown improvement. It's part of the journey to recovery and should be approached with empathy. Understanding these definitions helps us better support individuals affected by these issues and fosters a compassionate workplace environment. To understand the magnitude of the issue we're facing, let's discuss a few statistics. Every day in the United States, 100 lives are lost due to accidental drug overdoses. Additionally, there are 48 million people aged 12 and above who are using prescription drugs illegally. This is not just an issue of misuse, but a significant public health concern. Moreover, over 16,500 prescription drug overdose deaths occur annually in the U.S. Each of these numbers represents real people, friends, family members, colleagues, affected by this crisis. As we move forward, we'll explore how these statistics translate into real-world impacts on our workplaces and communities. In this slide, we will discuss the impacts of substance abuse, particularly in the workplace. Interestingly, 71% of illegal drug users are employed. This statistic highlights a critical issue that needs addressing. Let's consider how this affects employee health. Substance abuse can lead to both physical and mental health problems, impacting not just the individual but their colleagues as well. Now, think about productivity and decision-making. Employees under the influence may struggle to concentrate, leading to decreased efficiency and poor choices, which can have a ripple effect on the entire team. Safety is another key concern. Impaired judgment or slowed reaction times can lead to accidents, putting everyone at risk. Lastly, we must consider employee morale and security. A workplace affected by substance abuse can suffer from a lack of trust and a dip in morale, which can further affect productivity and the overall work environment. Let's delve into the continued impacts of substance abuse on the workplace. This slide focuses specifically on workers' compensation, medical costs, absenteeism, and employee turnover. First, workers' compensation. Substance abuse can lead to higher incidence of workplace accidents, which in turn increases workers' compensation claims. This is a significant cost factor for employers. Next, medical costs. Employees struggling with substance abuse often require additional healthcare services, driving up medical expenditure for employers. It's a cost that can be managed with proactive support and intervention. Absenteeism is another critical issue. Employees dealing with substance abuse may miss work more frequently, affecting not just their productivity, but also impacting their teams and overall company efficiency. Finally, consider employee turnover. High turnover rates related to substance abuse mean that companies often face increased recruitment and training costs. It's a cycle that can be mitigated with supportive workplace policies and programs. Understanding these impacts helps underline the importance of addressing substance abuse proactively in the workplace. Substance abuse can also greatly affect workers' compensation. First and foremost, companies face increased rates. This financial burden often trickles down to employees, resulting in lower wages and bonuses. It's a cycle that affects everyone in the organization, not just those directly involved. Additionally, there's a reduction in premium compensation. This means less incentive for employees to engage or stay with the company, impacting overall morale and retention. And here's a staggering statistic. Alcoholism alone results in 500 million lost workdays each year. This highlights the broader implications on productivity and company health. Understanding these impacts can help us work towards strategies that mitigate these challenges and foster a healthier workplace environment. As it pertains to medical cost related to substance abuse, let's first consider premium rates. Companies face increased insurance premiums due to the higher medical costs associated with substance abuse. This can lead to a financial strain not only on the company but also on employees, as it may affect wages or bonuses. Treatment and recovery. In 2020, the United States spent over $280.5 billion on mental health and substance use treatment. That's a staggering figure, and it reflects the immense burden drug abuse has on our healthcare system. Lastly, prescriptions. The costs of medications for treatment are a substantial component of these overall expenses. By addressing these medical costs, we can work towards a healthier and more productive workforce. Let's discuss the impact of drug use on employee attendance and productivity. First, consider this. Drug-using employees average 40 days of sick leave each year, while non-users take only about 4.5 days. This stark difference plays a significant role in absenteeism, affecting overall productivity. Now, think about the broader implications. When employees are frequently absent, it doesn't just disrupt their work, it affects the entire team's dynamics and output. It's not just about physical absence. There's also mental absence. Employees might be present but not fully engaged, leading to reduced productivity. As we move forward, let's reflect on how these issues tie into the bigger picture of workplace morale and employee turnover. Employee turnover and how it connects to workplace morale, particularly in the restaurant industry. First, consider that this industry is ranked the highest for illicit drug use. Substance use can significantly impact employee turnover rates. When employees frequently leave, it disrupts team dynamics, leading to a drop in morale. Random drug testing is often implemented as a preventive measure. While it can help identify issues, it's important to balance this approach with support for mental health. By fostering a supportive environment, we can strengthen workplace morale and potentially reduce substance use. Remember, the goal is to create a workplace culture where employees feel supported and valued, which can naturally reduce turnover and improve morale. Let's explore why drug use can become prevalent in the workplace. First, consider the idea that legality often translates to accessibility. Prescription drugs, despite being legal, are sometimes misused because they're easy to acquire. This misuse can stem from various reasons like fitting in or wanting to feel good. Depression and anxiety, including social anxiety, play significant roles too. Employees might self-medicate, thinking it alleviates their symptoms. Unfortunately, this can lead to experimenting with more substances. The availability of drugs creates a tempting gateway for some. It's crucial to understand these factors, not to justify behavior, but to comprehend the broader context. Recognizing these motivations can help us address the root causes and foster a healthier work environment. Now you may ask yourself, why would a person want to use drugs, especially on the job? It's interesting, and perhaps surprising, to learn that 71% of illegal drug users are employed. People often start using drugs acceptably, perhaps through experimentation, or in social or recreational settings. It can also be a way to relieve stress, which many of us can relate to in some form. It's important to consider these motivations, as they highlight the complex and varied reasons why someone might turn to drugs. By understanding these underlying factors, we can better address the issue and support those who need help. As we move forward, we'll dive deeper into the nature of substance abuse and addiction, exploring the potential consequences and challenges that come with it. Substance abuse is essentially about using substances in a way that alters our mood or state of mind, but importantly, it's done in a manner that's either illegal or harmful. This can impact not just the individual, but also those around them. Now, let's focus on some potential consequences of substance abuse. These include accidents or injuries, which can happen unexpectedly and affect day-to-day life. Blackouts, where memory loss occurs, can be particularly distressing. Legal problems often arise from actions taken under the influence, further complicating one's life. Then, there's the impact on professional life. Poor job performance is a common issue. This extends into personal life too, with family problems being a significant consequence that can strain relationships. Lastly, risky sexual behavior can increase the risk of HIV infection, adding a serious health concern to the list. It's crucial we understand these potential consequences, as they highlight the seriousness of substance abuse. Let's keep this in mind as we continue exploring this topic further. It's important to understand that abuse can manifest in various forms: emotional, behavioral, and physical. Each of these can have profound impacts on an individual's well-being. Emotional abuse often involves manipulation or psychological harm, while behavioral abuse may include harmful actions or patterns. Physical abuse, as the name suggests, involves bodily harm or the threat thereof. Recognizing these forms of abuse is the first step in addressing the issue and supporting those affected. It's crucial to approach this topic with empathy and an open mind, as it can be a sensitive subject for many. As we move forward, we'll delve deeper into the emotional effects of abuse and how they manifest. Remember, understanding is a key component in fostering a supportive environment for those in need. The emotional effects of substance abuse. First, we have aggression. Aggression can manifest as heightened irritability or anger, impacting relationships and work environments. Next is burnout. This is a state of chronic stress that can lead to physical and emotional exhaustion, reducing productivity and motivation. Anxiety and depression are also prevalent. These conditions can be debilitating, affecting one's ability to enjoy life or perform daily tasks. Paranoia often accompanies substance abuse, resulting in mistrust and fear that can isolate individuals from their support systems. Finally, there's denial. This is a common barrier to seeking help, as individuals may not recognize or admit to the extent of their problem. The behavioral impacts of abuse. First, we have slow reaction time and impaired coordination. These are critical because they can affect daily functioning and safety. Imagine trying to drive or operate machinery with these impairments. It's challenging and risky. Next, consider how slowed or slurred speech and irritability can influence interactions. These might lead to misunderstandings or conflicts in both personal and professional settings. Also, note the symptoms of excessive talking and an inability to sit still. These can be signs of underlying distress that might be overlooked. Lastly, limited attention span and poor motivation or lack of energy are significant. They can severely impact productivity and personal goals. Recognizing these behavioral impacts is the first step in providing support and seeking help. Let's talk about the physical effects of substance use, focusing on how it can impact workplace performance. Firstly, we often see issues like poor attendance and tardiness. It's not unusual for individuals to have unexplained absences or to take long lunches. Additionally, these behaviors can lead to complaints from coworkers or customers, as well as mistakes and missed deadlines. These problems not only affect the individual's performance, but can also impact the entire team's morale and productivity. We'll explore more physical effects on the next slide, so let's keep this in mind as we move forward. Firstly, weight loss is a common indicator. It's important to note that this can be quite noticeable and may reflect underlying health issues. Another sign is sweating. This isn't just about being a little hot. It can occur even when a person isn't active, which can be concerning. Chills are another effect. They can make individuals feel uncomfortable and may seem out of place, particularly in warm environments. Finally, there's the smell of alcohol. This can be a telltale sign and is often noticeable to those around the individual. It's a signal that can raise concerns about someone's well-being. Pause briefly to let the audience consider these points. Recognizing these physical effects is crucial in identifying potential problems early and extending support where needed. Make eye contact with the audience as you conclude this slide. Addiction. At its core, addiction is defined as the irresistible compulsion to use alcohol and other drugs, even when faced with negative consequences. One of the hallmarks of addiction is the repeated inability to control use. This lack of control often leads to increased tolerance, meaning individuals need more of the substance to achieve the same effect. Moreover, addiction doesn't just affect the individual, it disrupts the entire family. These disruptions can manifest in various forms, from strained relationships to significant emotional turmoil. As we move forward, we'll explore the types and risks associated with addiction, providing a deeper understanding of its impact. The first thing we need to understand about addiction is that it is a chronic disorder, meaning it's long-lasting and persistent. It's not something that simply goes away over time without intervention. It's also progressive. It tends to worsen over time, often leading to increasingly severe consequences. Think of it as a snowball effect, where small issues can quickly grow if not addressed. Addiction is considered primary because it is not just a symptom of another condition, but a central disorder in itself. Finally, it's terminal, indicating that without treatment, addiction can be life-threatening. Understanding these characteristics helps us appreciate the complexity of addiction and underscores the importance of early intervention and comprehensive treatment strategies. Addiction is often referred to as a family disease, and that's because it doesn't just impact the individual. Everyone around them feels the effects. One key point here is that addiction can be both hereditary and a learned behavior. This means some of us may be more susceptible to these problems simply because of our genetic makeup or the environment we grew up in. Another critical aspect is how prior abuse of alcohol and other drugs can set the stage for addiction, leading to a pattern of psychological dependence. For some, this decline might be slow, while for others, it can happen rapidly. Understanding these risks is crucial as we navigate the complexities of addiction. Let's explore further in the next slide. Continuing with the risk of addiction. It's crucial to recognize that these factors often intertwine with a self-destructive lifestyle. Many individuals turn to addictive behaviors seeking relief from depression or in response to crises in their lives. This can create a dangerous cycle where the substance or behavior becomes a temporary escape, but not a solution. It's also important to acknowledge that some people develop severe addiction problems before they even realize it. This underscores the need for awareness and early intervention. Let's keep in mind that understanding these risks can empower us to support those in need and encourage them to seek help before it's too late. Enabling behaviors are actions that, although well-intentioned, may shield an employee from the consequences of their behavior. When we enable, we inadvertently help the employee avoid addressing the root of the problem. This can occur through various actions, such as covering up. We might hide or excuse their mistakes, thinking we're helping them, but in reality, we're preventing them from facing the outcomes of their actions. Rationalizing. This is when we justify their behavior, perhaps attributing it to stress or personal issues, instead of recognizing it as a part of a bigger problem. Withdrawing or avoiding. Sometimes we might distance ourselves, hoping the issue will resolve itself. But by avoiding it, we're not providing the support they truly need. Other enabling actions include blaming others, trying to control the situation, or even threatening, which can all backfire. Emphasize the importance of awareness. It's crucial to be aware of these behaviors so we can support our colleagues more effectively. By understanding these actions, we position ourselves to better help rather than hinder. Let's be mindful of not falling into these enabling traps. Let's talk about the traps that family members and coworkers often find themselves in when dealing with someone struggling with drug or alcohol issues. It's easy to fall into these traps without even realizing it. The first key point is sympathy. While it's natural to feel sympathy, we need to balance it with the right actions that encourage accountability. Next, consider excuses and apologies. These might seem harmless, but they can actually enable continued problem behavior. Finally, let's address diversions like anger or tears. These emotional responses can mislead us and prevent us from addressing the root issues. It's essential to recognize these traps so we can support each other effectively. By being aware of them, we can better focus on constructive solutions. In the next few slides, we will explore the crucial link between behavior and performance in the workplace, specifically focusing on drug-related issues. Let's start by discussing drug testing. It's an essential tool for maintaining a safe and productive environment. However, it's important to approach this topic with sensitivity and respect for privacy. Next, we'll consider the signs of an overdose. These can include symptoms like extreme drowsiness, confusion, or unresponsiveness. Recognizing these signs swiftly can be life-saving. Lastly, let's talk about how to recognize employees under the influence. This isn't about suspicion or judgment. It's about ensuring safety and support. Look for changes in behavior, such as erratic actions or noticeable shifts in demeanor. By understanding these elements, we can better support our teams and foster a healthier workplace. Recognizing certain behaviors can be crucial in determining whether someone is under the influence. These behaviors can often mask deeper issues, so it's important to recognize them early. First, manipulative individuals may often blame others for their own shortcomings. This deflection can prevent accountability and stifle progress. Next, lying can be a common tactic. It creates an environment where trust is compromised, making it difficult for teams to work effectively together. Aggression and intimidation also play a role, as they can be used to control or dominate a situation. These actions not only affect the individual involved, but can also lead to a toxic workplace atmosphere. Lastly, emotional abuse, although sometimes subtle, can have a profound impact on team dynamics and morale. It's crucial to address these behaviors head-on to foster a healthier work environment. By understanding these behaviors, we can better support our colleagues and create a more inclusive and respectful workplace. Performance. Firstly, poor attendance and tardiness are significant indicators. When employees frequently show up late or have unexplained absences, it disrupts the workflow and places a burden on their peers. Secondly, we often see a decrease in the quality of work. This can manifest as mistakes or missed deadlines, which can frustrate both coworkers and customers, leading to complaints. Lastly, it's important to recognize these signs early. By addressing them, we can offer support and potentially improve the situation before it worsens. Next, let's discuss the different types of drug testing we conduct. Understanding these categories helps us ensure a safe and productive workplace for everyone. First, pre-employment or job applicant testing is conducted before hiring to ensure potential employees meet our standards. Next, we have reasonable suspicion testing. This happens when there is a justified belief that someone may be under the influence during work hours. It's important for maintaining safety and integrity in the workplace. We also conduct routine fitness for duty testing to ensure employees are capable of performing their job responsibilities safely. After a positive test, follow-up testing is required. This helps verify that the individual is compliant with our policies and supports our drug-free environment. Post-accident testing is crucial. It helps determine whether drugs or alcohol were a factor in the incident. This is key for workplace safety and accountability. Lastly, random testing is done to deter substance abuse and ensure ongoing compliance. Remember, failure to submit to a required test is considered misconduct. This could lead to serious consequences, including discipline or even termination. It's important for everyone's safety and fairness. Let's keep our workplace safe and supportive for all. We test for several key substances: marijuana, cocaine metabolites, amphetamines, opiate metabolites, phencyclidine, or PCP. These are not just the scientific names. They have various street names and can appear in many different forms. It's crucial to be aware of this diversity. Understanding these substances helps us maintain a safe and productive workplace. Remember, this knowledge not only protects our work environment but also supports our commitment to health and safety. Confidentiality is a crucial aspect of our substance abuse testing program. Crain Construction is committed to maintaining the confidentiality of all information obtained through this program. This is not just a matter of policy. It's a requirement under the rules set by the Drug-Free Workplace Program of the Tennessee Bureau of Workers' Compensation. By adhering to these guidelines, we ensure respect and privacy for all individuals involved. This helps us create a safe and supportive work environment. Remember, maintaining confidentiality builds trust within our organization, and it's everyone's responsibility to uphold this standard. The following are the most abused drugs in the United States: alcohol, marijuana, pain relievers, hallucinogens, depressants, cocaine, stimulants, inhalants, meth, and heroin. Let's delve into the issue of alcohol abuse and its impact on behavior, particularly in the workplace. First, consider the problem of absenteeism, often most noticeable on Mondays. This pattern can be a red flag, suggesting a deeper issue related to alcohol use. Next, let's talk about blackouts and memory loss. These aren't just temporary lapses. They can have serious consequences on both personal and professional levels. Relationships can suffer, and work performance may decline. Finally, the fixation on drinking, whether during social or professional occasions, is a hallmark of alcohol abuse. It can lead to difficulties in walking and maintaining balance, which are clear signs of dysfunction. As we explore these symptoms, let's remember that understanding them is key to providing support and seeking solutions. Marijuana, also known as cannabis. Now, the active ingredient here is tetrahydrocannabinol, or THC for short. It's important to note that while marijuana isn't physically addictive, it can be moderately addictive psychologically. You'll also hear marijuana referred to by other names such as weed, ganja, or trees. These are terms you might come across in different contexts, so it's useful to be aware of them. As we delve further into this topic, keep in mind that understanding these substances, including their effects and aliases, helps us make informed decisions. CBD, also known as cannabidiol, this is an essential component of medical marijuana and comes from the hemp plant. Now, it's important to note that CBD contains less than 0.3% THC, so it doesn't have the psychoactive effects associated with marijuana. But the legality of CBD can be a bit complex. Many states have legalized it, though there are varying levels of restrictions. However, the federal government still classifies CBD in the same category as marijuana, which brings about a lot of legal challenges and confusion. Additionally, it's worth mentioning that CBD is not regulated by the FDA, so its quality and safety may vary. Keep in mind these nuances as they can impact not only personal use but also professional environments. In this section, we will discuss a few additional differences between THC and CBD. First, while both THC and CBD come from the cannabis plant, they have different legal statuses and effects. THC is considered an illegal substance, and its psychoactive properties can result in legal issues, especially in workplaces with drug screening policies. For those in safety-sensitive positions, or where drug screening is routine, the best practice is to avoid using products containing THC and CBD entirely. This is because drug screens cannot differentiate between THC and CBD, which can lead to unintended consequences. Remember, the mode of entry, whether smoking, vaping, or ingesting, doesn't change the potential for a positive drug test. It's crucial to stay informed about the regulations and risks associated with THC and CBD use, especially in professional settings. Let's explore the effects of inhalants. These substances can be extremely dangerous, even in small amounts. Firstly, they can cause a loss of muscle control. This means individuals may suddenly lose their physical coordination, leading to potential accidents. Inhalants also cause slurred speech, which can be a clear and immediate sign of use. Beyond these initial effects, they pose severe health risks like respiratory failure and cardiac arrest. Additionally, prolonged use can lead to brain and lung damage, which can have lasting impacts on a person's life. Most alarmingly, inhalants can be fatal, underscoring the critical need for awareness and prevention. These effects highlight the importance of understanding and recognizing the dangers associated with inhalants. Next, let's discuss stimulants and a few of the signs and symptoms of stimulant use in the workplace. First, we have increased heart rate and respiratory functioning. These physical changes can sometimes be noticeable in individuals who seem more alert and restless than usual. Now, while these symptoms might initially seem like someone is just high energy, it's important to recognize the potential for psychological and physical dependency. This can manifest in changes like decreased appetite and increased agitation. Recognizing these signs early can make a significant difference in addressing potential issues effectively. Depressants and how they can affect a person's behavior and appearance. Depressants are often associated with symptoms like frequent doctor visits for conditions such as nervousness, anxiety, or stress. A person using depressants might seem like they're drunk, even when there's no smell of alcohol present. You may notice limited or no facial expression, making their personality appear flat. They might also seem to lack energy, and slurred speech is a common sign. Remember, observing these signs can be crucial in identifying someone who may need help. Keep an open mind and be supportive. Narcotics can have a profound impact on both physical and psychological states. Let's explore some of the key signs and symptoms. First, individuals may appear lethargic or unusually drowsy, often accompanied by either constricted or dilated pupils. These are telltale physical indicators you might notice. Heavy sweating and disoriented senses are also common, alongside slurred speech, which can sometimes be mistaken for other conditions. Additionally, redness and rawness around the nostrils often result from inhalation methods. Lastly, pay attention to signs of isolation or detachment from their surroundings, which can be a strong psychological indicator of narcotic use. By understanding these symptoms, we can better recognize when someone might need help and support. Designer drugs, specifically ecstasy, LSD, bath salts, and fentanyl. These substances can have serious physical and psychological consequences. Let's start with the physical effects. They can include hypertension, blurred vision, tremors, and even paralysis and seizures. In severe cases, they may lead to brain damage or death. On the psychological side, users may experience confusion, irritability, and anxiety. There's also potential for more severe issues like irrational behavior, depression, and violent tendencies. These drugs are particularly concerning because of their unpredictable nature and the extreme risks involved. As we move forward, we'll see how even over-the-counter medications can have surprising effects, underscoring the complexity of drug interactions. Over-the-counter drugs. These medications can have unexpected effects on workers, especially if there's a reaction or interaction with other drugs. While these reactions can be unpredictable, they may mimic symptoms of alcohol or illicit drug use. Importantly, though, these effects stem from legal substances. Given this potential impact, it's worth considering a workplace policy on OTC drugs. Such a policy might be tailored to specific job descriptions, ensuring safety without unfairly penalizing employees for using legal medications. Have you ever considered how an OTC drug might affect you or someone you work with? It's a crucial conversation to have, especially in roles where safety is paramount. Let's talk about some commonly abused over-the-counter drugs or prescriptions. These drugs might seem harmless because they're readily available, but misuse can lead to serious consequences. First, we have dextromethorphan, or DXM. This is often found in cough medicines. While it's effective in treating coughs, when taken in higher doses, it can cause hallucinations and other harmful effects. Next is pseudoephedrine or phenylephrine, which are common in decongestants. These can be abused for their stimulant effects, often leading to increased heart rate and blood pressure. Diphenhydramine, or DPH, is found in sleep aids. Abusing this can result in severe drowsiness, confusion, and even hallucinations. Acetaminophen, a common pain reliever, is safe when used as directed, but overdosing can cause liver damage. Lastly, don't overlook antacids like Tums, Alka-Seltzer, or Mylanta. While typically safe, excessive use can lead to electrolyte imbalances. It's crucial to understand that even medications we consider routine can be dangerous if misused. Let's be mindful of these risks and educate others to prevent potential abuse. Let's talk about the signs of an overdose. Recognizing these can be crucial in getting help quickly. First, we have cold, clammy skin. This is often a visible sign that something is wrong. Next, cyanosis, or a bluish tint to the skin, particularly around the lips and fingertips, indicates a lack of oxygen. This is a serious warning sign. Pinpoint pupils and slowed respiration are also key indicators. These symptoms suggest that the body is not functioning as it should, and immediate medical attention is needed. Finally, unconsciousness is a critical sign that the situation is severe. It's important to be aware of these signs so that we can respond appropriately and ensure safety in the workplace. Let's take a moment to consider the challenges some people face in their professional lives. The struggles with job performance can sometimes be linked to personal issues, like addiction to alcohol or drugs. This isn't always apparent, and recognizing it can be difficult. Help is readily available. It's crucial to remember that while a supervisor might suspect that personal problems are affecting an employee's performance, the responsibility to acknowledge and address these issues lies with the employee themselves. Providing support is vital, and we'll explore how we can offer assistance next. Let's talk about the importance of taking personal responsibility when it comes to seeking assistance. First, it's crucial to understand that deciding to seek help is entirely in the hands of the employee. This decision is private and respected. Second, remember that addiction is treatable and reversible. This means there's always hope and a path to recovery. Lastly, it's vital to reiterate that an employee's choice to seek help remains confidential. This assurance protects privacy and encourages individuals to take the necessary steps without fear. As we move forward, we'll explore how the Employee Assistance Program can further support employees in these situations. Let's explore how the Employee Assistance Program, or EAP, supports our workplace community. The EAP is a valuable resource if you're facing challenges with alcohol or drugs. It's not just for you personally, but also if someone in your family or work group needs guidance. One of the most important things to remember is that these conversations are completely confidential. This means you can approach the EAP with peace of mind, knowing your privacy is respected. Confidentiality is a cornerstone of the EAP. The information shared remains private, providing a safe space to seek help. The EAP is here to support you, offering guidance in a confidential and caring manner. Remember, taking the first step towards assistance is both a personal and courageous decision. Today, let's focus on the various avenues of support available to employees dealing with addiction issues. First, talking to a supervisor can be a good starting point. Supervisors are often trained to provide guidance and support, and they can help direct employees to the right resources. Remember, supervisors are there to help, not to judge. Employee assistance programs, or EAPs, are another fantastic resource. They offer confidential support and can help you decide the best course of action. Whether it's for personal struggles or concerns about someone in your family or work group, EAPs are there to help. Additionally, healthcare programs and outside agencies are available. Community hotlines and mental health centers provide support and information. Organizations like Alcoholics Anonymous, AA, offer peer support and recovery programs. Remember, help is always available. You don't have to face these challenges alone. Today, let's focus on the various avenues of support available to employees dealing with addiction issues. First, talking to a supervisor can be a good starting point. Supervisors are often trained to provide guidance and support, and they can help direct employees to the right resources. Remember, supervisors are there to help, not to judge. Employee assistance programs, or EAPs, are another fantastic resource. They offer confidential support and can help you decide the best course of action. Whether it's for personal struggles or concerns about someone in your family or work group, EAPs are there to help. Additionally, healthcare programs and outside agencies are available. Community hotlines and mental health centers provide support and information. Organizations like Alcoholics Anonymous, AA, offer peer support and recovery programs. Remember, help is always available. You don't have to face these challenges alone. To conclude this training, let's reaffirm why a drug-free workplace is crucial for safety. First, understanding the significant impact alcohol and drug abuse can have on our work environment is crucial to business operations. It affects productivity, safety, and the well-being of everyone involved. Understanding and adhering to our drug-free workplace policy is not just a formality, it's a commitment to a healthier, more secure work setting for all. Also, remember the types of assistance available to support you or your colleagues. We have resources that can help navigate these challenges effectively. Lastly, I want to highlight the Substance Abuse and Mental Health Services Administration. Their website, www.svsc.gov, is a valuable resource for additional support and information.